My name's Nicholas Seraphim from Seraphim's Burke Street Pharmacy at Taylor Square, Darlinghurst. My pharmacy was established in 1951 by my father. We're open 7 days and nights a week. There are a number of HIV doctors who specialise in HIV treatment within the area, and also organisations that cater for patients with HIV needs. Well, at the moment, people have been either obtaining their drugs through the hospitals or the clinics. People now are able to come into their community pharmacy and access the HIV medications. This is going to give obviously people greater choice and greater convenience on where they now choose to get those medications. So they'll have a greater access to their drugs. You're now able to sort of treat the patient more holistically because you're now seeing all the medication that client's on. So pharmacists can play a greater role in helping with treatment care of those clients. So pharmacists can facilitate the patient's access to medication and thereby increasing their adherence to that medication. We can help them in either providing them with dosage administration aids, which they can either pack themselves or their community pharmacy can pack. It's very important to maintain that adherence to the medication, because otherwise there is the risk of getting drug resistance or even resistance to actually classes of drugs. So patient adherence is a very important issue with HIV patients. Pharmacists can also play a role in helping to remind patients when their prescriptions are due to be refilled, so that they can go and see their prescriber and have a prescription. It would even be advantageous for people to leave those prescriptions at their local pharmacy, and that would give them the opportunity to phone ahead and give the pharmacist time to prepare their medication, and that way it's convenient for both the pharmacist and the patient so that everything runs smoothly. That's particularly important in rural areas where there may be issues in obtaining medications, and giving that extra time to the pharmacist is going to ensure that the patient has the medication when they actually need it. Patient privacy is a very important issue in dealing with HIV clients, and I think it's important to have adequate staff on duty to ensure that you can provide that service. All quality care pharmacists have got a privacy policy in place, and that ensures that both the pharmacists and the staff are trained in handling privacy issues. Patients in regional and rural areas are obviously very concerned about privacy issues, and I think they need to discuss that with their local pharmacy. Maybe it's a matter of the pharmacist dispensing and handing that medication directly out to that patient. Maybe that patient wants to continue with how they're getting their medications currently, or there are pharmacies may even do an online thing and actually post the medication out to the patient. So I think that the privacy issue can be solved. It's just a matter of people talking to their local pharmacist and working out what suits them. A lot of pharmacists will not be familiar with the HIV medications. There is training programs available through the PSA. There's a variety of articles written in the pharmacy journals that will do case studies and help familiarise people with the HIV medications and give the drug profiles, interactions and just general things to be aware of. ASHM and the PSA will be producing a very reader-friendly information booklet which details a general history of HIV along with the medications and also common side effects. It also provides you with some very important links to some websites. The Liverpool Hospital one is particularly useful for drug interactions. So these resources will be available and you won't be left on your own. There's ample places where you can get further information in this area.